lot of things. We do, of course, Narcan trainings, Narcan distribution, so I oversee all of that, as well as we have a syringe services program in the county, which actively supports a person who is dealing with substance use disorder. So sometimes people may not be ready to go into treatment, so we try to help support them, keep them alive, keep them safe, and try to build that relationship until they're ready to pursue their treatment and recovery. And then we also do efforts around distribution of fentanyl test strips and xylazine test strips, where a person could actually test their substance to know if it was laced with fentanyl or with xylazine, which is another adulterant or something else that could be laced into substances. In addition to that, also overseeing efforts to expand access to harm reduction supplies. So looking to expand into like harm reduction vending machines, where a person could actually access different Narcan and other supplies as well from those types of machines. In addition to expanding just some other efforts just to try to attack the issue in the county. So happy to be here with you this evening. Tara and others realize I've been up here quite a few times, so I feel like I'm a veteran now, not that first timer anymore. I already knew I could stop and get dinner at McDonald's if I needed to when I came up. So in this training, I'm just going to cover some overdose data for Montgomery County. We'll talk about what is an opioid, recognizing an opioid overdose, so looking at the signs and symptoms. Then we'll discuss responding to that overdose, so the importance of using naloxone, rescue breathing, contacting EMS, caring for the individual, tips for prevention, and then some resources that I'll share with you as well. So in 2021, we unfortunately lost 158 lives to overdoses. Naloxone was administered 624 times, and lives saved from administration was 605. So those numbers there could be duplicative numbers, meaning a person could have been administered naloxone on multiple occasions. Also, those are the numbers from EMS. So outside of like...
Is that just Montgomery County?
Just Montgomery County, yes ma'am, yeah. So those do not include numbers where a citizen or anyone administered Narcan and a person was revived, because sometimes now people will administer Narcan and not call EMS, which we try to encourage them to, because they might need some additional supports beyond that. In 22, we lost 109 lives to overdoses. And then naloxone was administered 627 times, and then lives saved was 608. For the overdose numbers, I want to let you know that they do include overdoses from alcohol, cocaine, other drugs as well. And I want to say for the 109 number, I think it was around like 94, 95 that were opioid related. All right. This slide here I'm sorry, it's kind of small to see, but we put it in here just to kind of give a example of how we kind of got to where we are. If you think about the pharmaceutical industry and things like that, and how the American people were told like, hey, these are safe, but they actually weren't. Well, about 70% to 80% of the people that talk about are dealing with opioid use disorder started out with a prescription medication. And so the DEA did some research into the pain pills that were ordered throughout the country. We were able to extract the information specific for Montgomery County from 2006 to 2012. And you can see the increase of how many pain pills were being sent to our county, right? So I share this because one, it kind of helps us tell the story of how we got to where we are, where, now we're being, inundated with a lot of street versions of those pain pills and things like that. And then I also like to educate people on a couple shows that really help to tell the story. So there's a 2-part docuseries on HBO called The Crime of the Century, which talks about Purdue Pharma and how we kind of got to where we are. And then also it talks, then there's another one called Painkillers. And then there's some other, Dope Sick on Hulu, and some others that really kind of give a depiction of how we got to where we are today. So looking at what is an opioid. So it's any drug that contains opium or its derivative, natural or synthetic, can come in a pill, powder, capsule, or liquid, can be swallowed, drunk, smoked, snorted, or injected. And we know that a natural form of an opiate is morphine. and a synthetic form, which we call an opiate, is fentanyl. So that's a prime example of a synthetic form of opium. These are used to manage pain, suppress cough, treat opioid use disorder, cause feelings of euphoria, contentment, detachment, and the feelings can last in the body between 3 to 24 hours. So thinking in terms of like examples of like your immediate time release medications that could be in the body between 12 to 24 hours. So like oxycodone or something like that you might get from the ER, stuff like that. And then like your heroin, fentanyl, those can be in the body between like 3 to 5 hours, depending on how much a person has taken. And then we know that opioids are a central nervous system depressant, so they slow down a person's ability to breathe, so they suppress breathing. Here are some examples. So you have oxycodone, which is the number one misused and abused prescription medication in the country. You have hydrocodone, which a person might be prescribed if they experience like a tooth extraction or go to the dentist or something like that. You have hydromorphone and then oxymorphone. Hydromorphone is more so coined the slang term of hospital heroin. Because you might get that prescribed to you in the ER or something like that. Then you have morphine, which is the base opioid, with all other opioids or medications are developed and compared. So thinking in terms of like potency, heroin is about 3 to 50 times stronger than morphine, and then fentanyl, which is what we're seeing a lot today, is about 100 times stronger than morphine. And then you also have, which we haven't seen in Montgomery County, it's a carfentanil. It's like an animal tranquilizer. It's used on big game elephants. Veterinarians use that type of drug, and that's about 10,000 times stronger than morphine. Then you also have methadone and buprenorphine, which are your opioid antagonists. They're both used to treat opioid use disorder. So you'll see those in like medication-assisted treatment programs and things like that. We added this slide here to give a clear depiction of what a lethal dose of heroin and what a lethal dose of fentanyl looks like. So thinking in terms of how it might be dosed in a medical setting, because there is medical grade fentanyl, it might be dosed in micrograms, where when the drug networks are creating like these fake pharmaceutical pills and things like that, they might be dosed in milligrams, which of course is a lot more stronger than what should be provided. Just like I said, you do have prescription strength fentanyl, which is shown here on the screen. Unfortunately, there was a lot of fear perpetuated around fentanyl as far as like if you touch it, you'll experience an overdose and things like that. Well, that myth is not true. The only way that fentanyl can soak into the skin is through a transdermal patch. I actually got into an Instagram argument about how fentanyl works and things like that with someone, and they was basically saying to me, well, if you sweat a lot and your pores are open, can it soak into the skin? I said, well, I've never read or heard of that happening before, but not saying that it can't happen, so you got to be safe, right? But it's just funny how people try to like go back and forth with you about stuff and they haven't even read the science or the literature. Also, at one point in time, there was fear out about rainbow fentanyl. So it was brightly colored. People were feeling it was being marketed to young people. We haven't seen much of it anymore. That's probably like a year ago, but we still kind of educate on it just because it comes in pill, powder, or blocks similar to like sidewalk chalk. And then here, of course, you got your illegal opioid heroin. So I've been in the field for, 18 years now. And when I first started, we were dealing with black tar heroin in North Carolina, where I'm from. So, and then it kind of transitioned to the powder form. And then now, a lot of times the clients that we work with indicate that they can't even find heroin anymore, just because the market is flooded with fentanyl. And then, of course, you have your legal non-pharmaceutical fentanyl, which is illicitly produced. And this is what I really wanted to get to, is the fact that a lot of the drug networks are creating these substances, and then they're making them to look just like the pain pills you might get from a doctor. So they're looking just like the oxycodones and the Xanaxes and the Adderalls, and they're saying, hey, it's a Percocet or it's this and that, but it's actually laced with fentanyl. And unfortunately, some of the people who have experienced overdoses are thinking they're getting a Percocet, or they're thinking they're getting Oxycontin, or thinking they're getting something else, but it's actually fentanyl, and they don't realize that, right? You know, I always try to educate young people, like if one of your friends try something, you want to be prepared to have Narcan on hand for just in case something happens, right? All right. So recognizing the opioid overdose. So what happens is a toxic amount of the opioid overwhelms the body's ability to handle it. This happens when it's either used by itself or alone. And now with the strength and potency of these substances, using it alone typically will induce a overdose experience. Mixing with other drugs like benzodiazepines and also cocaine and alcohol. There's been situations where a person was thinking they were buying cocaine and it was laced with fentanyl as well, and that's what eventually caused the overdose and unfortunately the death. So what leads to the overdose is respiratory failure. So it's a lack of sufficient oxygen in the body. So the vital organs like the heart and the brain start to fail, and then it leads to unconsciousness, coma, or death. So I always try to tell people, if you don't have Narcan on hand, if you made the attempts of doing rescue breathing for the person, so trying to get oxygen into the body, you give them a higher likelihood of survival if you didn't do anything at all. So even if you didn't have Narcan, if you just tried to breathe for the person, you give them a greater chance of survival if you didn't do anything at all. Signs and symptoms of the overdose. So you got slow, shallow, or no breathing, unresponsive, unconscious, loud snoring or gurgling noises. The body could be very limp. So that means that they basically lose the ability to kind of sit up on their own. They're just kind of slumped over, things like that. The loud snoring or gurgling noises are sound more like, they call it like a death rattle, but it's them really trying to like gasp for oxygen and air on their own, but they're struggling. Lips, fingertips could turn blue or gray. The skin could be pale, gray, or clammy. And then of course the pulse could be slow or erratic. So a lot of times I get questions of like, hey, if you come into contact with someone and they're unresponsive, you know, what do you do? Well, in good practice nowadays, it's actually good to administer Narcan because there's no real ill side effects. But people will administer Narcan to rule out if it's an opioid overdose or not, and then go to the next steps of if they're dealing with like a heart attack or some kind of other issue or something like that. Responding to the overdose. So one of the key tools to responding to the overdose is Naloxone. So it's the medication that reverses the overdose and restores breathing temporarily. It wears off between 30 minutes to 2 hours. So remember earlier I spoke how depending on the opioid, it can be in the body between 3 to 24 hours, right? So it's safe for children and pregnant women. There are various delivery mechanisms. So you got intramuscular, intranasal, or intravenous. In Montgomery County, we only train on and provide the intranasal version. So if you've ever had allergies, which I started having allergies when I moved up here. If you've ever administered Flonase, it's that simple. But the only thing about Flonase is that you have multiple doses in there. In Naloxone or Narcan, you have one dose. So once you press that plunger, that's one dose of Narcan. Now share these little demos so you can kind of pass them around. All right. So and then they come in a little pouch like this. So all right. So no potential for misuse, no effects on someone who hasn't taken an opioid. So just like I was saying, people administer just to rule out if it's an opioid overdose. Side effects are minimal and rare. And then Naloxone is only effective to reversing an opioid overdose. So if someone is overdosing on alcohol, they're overdosing on cocaine or something like that, Naloxone will not be effective on it. Also, like I was saying, there's another substance that they're lacing the drug supply with called xylazine. And unfortunately, that is not an opioid. So Naloxone is not effective on the xylazine. It will deal with the opioid if there's an opioid in there, but the person will still be under the xylazine trance. So that's why another reason why it's important to get medical help there, because they'll know what to do to kind of help support that person. Storage. So we recommend not opening the Naloxone until it's ready to use, keeping it, of course, in its original packaging. So we put all of our Narcan kits in bags like this. And then your dose of Naloxone or Narcan is in there just like that as well. Storing in original packaging, keeping it at room temperature. Some people like to leave it in their glove box. I try to recommend not to, just because of the extreme differences in temperatures. But the Department of Defense did some research on it to show that it actually didn't do too much to it. It was still effective. Avoid exposure to extreme light, keep it in a safe place. It does have an expiration date. So the Narcan kits, thank you, sir. The Narcan kits that we have expire in March of 2026. So just be mindful of that. But of course, again, Department of Defense did some more research on it and found out it was about effective about 5 years beyond its expiration date. So usually when a person calls and say, "Hey Ben, our kit expired, can we get another one?" We would definitely replace it for free. But we just say, "Hey, you're more than welcome to just keep the other kit for additional doses, or you can just throw it in the trash, whatever you decide." All right. So how does the overdose happen in the body? So in our brain, we have opioid receptors. And basically, when a person takes an opioid, it binds itself to the receptors, impacting a person's ability to breathe. All right. And then when you administer naloxone, it has a stronger affinity to those receptors, kicking the opioid off and binding itself to the receptors and restoring breathing temporarily for that individual. So responding to the overdose, first you want to try to rouse and stimulate. You call 911, you give naloxone, you perform the rescue breathing, and then you care for the person. So rouse and stimulate. So you want to try to wake them up. Are you all right? Call their name. If they don't wake up, then you make a fist and do a sternum rub. So you rub them firmly up and down the breastbone, and that pain might be enough to wake them up. If it doesn't, then you want to go to your next step, of course, of calling 911. Just because we know that the naloxone is only temporary. The person may have other complications, right? So I already talked about the xylazine issue that they may experience. Need more naloxone, and then it may be a non-opioid overdose. Another thing is a reason why we encourage to call 911 is because a person may need additional doses of naloxone to be revived. So in our kits that we provide, we only provide 2 doses in each kit. But there's been instances in the county where a person needed up to 7 doses to be revived and brought back from that overdose. Yeah, so that just lets you know how potent and strong these drugs are that are on the street. And then step 3, you give the naloxone. So in the kits that we provide gloves just to kind of protect you from any bodily fluids or anything like that. You put the gloves on, peel the tab to open the circle with the Narcan nasal spray. So it's just like this, like a piece of foil. And then you hold the thumb on the bottom of the plunger and your first and middle finger on either side of the nozzle, like so. And then you tilt the head back and support the person under the neck, and then gently insert the tip of the nozzle into the nostril until the fingers are at the bottom of the nose. And then you just press that plunger firmly, and then that's 1 dose of naloxone. Doesn't matter if you do the right nostril or left nostril. Just choose one and hit them with the Narcan. All right. So while you're waiting for the naloxone to work, because you want to give it about 1 to 3 minutes to take effect. All right. But while you're waiting for that, you're going to go ahead and transition to your rescue breathing. All right. So if the person is not already laying on a flat surface, you want to lay them on a flat surface, tilt the chin to open the airway, and then pinch the nose shut and make a complete seal over their mouth with your mouth, and then blow 2 regular breaths, and then you want to give 1 breath every 5 seconds. All right. So if the chest doesn't rise, you want to retilt the head and then give those 2 breaths again. Also in the kits, we provide one-way face shields, just to also protect you from any bodily fluids. Those are in there to help with the rescue breathing piece as well. After that 1 to 3 minute window, you've administered naloxone, you did the rescue breathing, they've woken up, right? Now you're going to transition to step 5, which is caring for the person. So stay with the person until medical help arrives. If the person can't sit up, you want to put them in a recovery position, which I'm going to show you in a moment. You want to keep them calm, encourage them not to take any more opioids, or let them know what happened. Because a lot of times when people are brought up out of their overdose, they're confused. They didn't know that they overdosed. They're scared. And so you just want to kind of keep them calm. And then if the overdose happens again, give another dose. So just like I was saying, these substances are very potent and powerful. And there's been instances where a person was administered naloxone, refused to go to the hospital, and then they experienced the overdose again, because basically the opioid jumped back on the receptors. Because remember, we talked about naloxone is only effective for that 30-minute to 2-hour window. All right. Okay, so this here is the recovery position. So if you have to leave the person briefly, you want to put them in this recovery position. This helps to keep the airway clear, keep them from choking. So one of the withdrawal symptoms from when you administer naloxone could be vomiting. And so you want to put them in this recovery position. It doesn't matter if you lay them on their right side or left side. You just don't want them laying flat on their back to keep them from choking. All right. If you administer, we recommend contacting poison control. We tried to simplify the process. So this QR code that's on the screen is actually in the naloxone pouch. So you just scan it with your phone. It'll bring up some questions and you just answer. That just helps the state to know, hey, people are actually utilizing these programs, and we can still put funding towards it and provide naloxone for free. Because I know you've all heard naloxone is actually over the counter now. So I'll talk about that in a moment. All right, so tips for prevention. So these were put in here. Just we do a lot of education around like fentanyl harm reduction and stuff like that. And so talking about like starting slow, going slow. So these are technically reduction measures for someone who might be actively using. So maybe not using as much as they normally would. So we try to encourage, going slow, using less. The quality and potency, so getting it from various suppliers and things like that. Using alone, so we try to encourage families who have a person who is dealing with substance use disorder to have a prevention plan in place. So sometimes we can't stop them from using, but we want them to at least be safe. So being able to check on them, if they say, "Hey, I'm going to go do what I do. My door is open. Please come and check on me if in a few minutes or something." Just trying to put prevention plans and things in place. First use is a risk factor. Recent abstinences. So I've seen cases where a person actually went into treatment or was incarcerated, and they came out and tried to use the exact same amount that they did when they went in, and that was the amount that unfortunately took their life because their tolerance was lower. Mixing drugs, age is a risk factor, and physical health as well. Looking at resources and information. So one key resource is the Good Samaritan Law. We do a lot of community awareness around the Good Samaritan Law, trying to educate people on the fact that if you're actively assisting someone with a medical emergency, then you're protected under the Good Samaritan Law. So meaning when I talk to young people, I always tell them like, hey, if there's 4 friends together and one friend takes something and they fall out and become unresponsive, one friend calls 911, one friend administers naloxone, one friend does rescue breathing. All 4 of them are protected under the Good Samaritan Law because they're actively assisting that friend with the medical emergency and the victim of the medical emergency. And that also goes for if someone blacks out from alcohol or something like that. So that law protects as well. Here's just if someone had previous criminal records and things like that, what it protects a person from possession of CDS. So speaking to the state's attorney's office specifically and law enforcement, when it comes to overdoses, they're trying to get to the supplier. They're not trying to arrest and prosecute victims and things like that. They're trying to help them get connected with services, but they're trying to get the supplies off the street. So they're going to ask questions and things like that, which is what they normally do, but they're not in the business of trying to arrest anybody because they experienced an overdose. So how to get naloxone, so completing this training. So I did bring kits for everyone this evening. Each of our kits, of course, has 2 doses in them. The local fire stations. So about a year and a half ago, my office worked with all of the local fire stations in Montgomery County. So you can walk into any fire station in Montgomery County and say, I would like a Narcan or naloxone kit, and they'll give you one for free, no questions asked. So that's another, so we were really trying to work to increase access to anyone who would want a Narcan kit, because technically in Maryland, you don't have to be trained. I just recommend it, and it's a part of our grant requirements to train you. So, and then, of course, you don't need a prescription, no proof of training or anything like that. Narcan is now over the counter. I'm not too sure of how much it costs. $49.99. All right, thank you. Okay, so and is that one dose or two doses?
I believe that's only one.
Okay, so in our case, there's two doses and it's free 99. So yeah, so please take it. I've had situations where families would come to my office and they would want to get the entire family trained all the way down to the 10-year-old because a brother or somebody was dealing with opioid use disorder, and and whoever would be in that position, they wanted them all to be prepared. So they walked away with 5-6 kids. So it's just about being prepared. And then of course, my program, harm reduction, we're overdose response. You can get a kit from us. Our syringe services office in Rockville is also another place to get Narcan. So they're open Monday, Tuesday, Thursday, and Friday from 10 to 4, and then Wednesdays from 10 to 7 p.m. So it's a late day. So I'll if you want to take a picture of this before you leave tonight, I'll leave that up here. And then some other local resources. So the county provides free mental health and substance use screenings within the county. This is access to behavioral health is specifically for persons 18 and up. They can go there, get a free substance use or mental health assessment, and then they'll provide them with a referral to a level of care. And then also the county has a county-run medication-assisted treatment program, which is located in the same building as our harm reduction services office. And then harm reduction services there. So in addition to providing Narcan and syringe services, we also do free HIV testing. We provide wound care. So I have a certified wound care nurse on my staff who will help support a person who might be using intravenously. She actually teaches them how to use safely intravenously, because sometimes people who might use intravenously may use substances like lemon juice or vinegar and things like that, which are very abrasive on the veins. And so she provides education and support where we give clean needles, pretty much anything under the sun you would think a person might use to hopefully be safe. We provide that. We give out condoms, sexual health education, all that happens in that program. And then also we have peer support services, which is housed technically at the crisis center, but it's basically peers that are deployed out if there's an overdose. So they get an alert from fire and rescue, and then they'll go try to meet the individual at the hospital or something like that, connect with them, and get them connected to services and things like that. And this training, this is just the article. It was created in the Code of Maryland Regulations, and that is it. Are there any questions? You all thought it was going to be 90 minutes, but it does not take that long, honestly.
So when administering Narcan, do you want the person to be lying flat or upright, or?
If you're administering Narcan, it doesn't necessarily matter if they're laying down or flat. You just want to tilt the head back so that so you just squirt it up in there.
Okay.
And I think with you having all those veins in your nasal cavity, that it should really soak in really well there. So, yeah.
All right, thank you.
Yes, sir.
I'm curious, I don't know if you have the answer to this. Why are these guys that are making these, all these drugs, like adding fentanyl to cocaine, if they know it's gonna kill their clientele? I mean, it doesn't make sense that what they're doing.
Yeah, so obviously they don't have a clear science of how they're mixing everything, right? Even thinking in terms of like if they're pressing it into like a pill to mimic what a person might get from a doctor, right? So I always tell people like if they test the pill, like shaving off a piece of the pill, test it with a fentanyl test strip and it comes up negative, that doesn't necessarily mean there's not fentanyl in the pill. It might be concentrated on the other side of the pill, right? So when it comes to these drug networks, they don't have a clear science of how much they're putting in what. You might get a batch that has more potency than the other, things like that, right? And I don't necessarily think they're in the business of killing people, but just like I said, if earlier in hospital settings they dose it in micrograms, and then what you're getting on the street is probably in milligrams. So, and then another thing to think about is the precursors actually for fentanyl come from China. So there's a lot of chemical companies in China that make the fentanyl precursor. Well, their number one buyer from the precursor is the Mexican drug cartels. And they take the precursor, make the fentanyl, and then ship it across the border. Well, think of it like this. Them trying to ship or smuggle 1 kilo of fentanyl in the country and cut it up and spread it out versus trying to smuggle 5 kilos of heroin, where they'll make more money off that 1 kilo of fentanyl than they would do off those 5 kilos of heroin.
Has there been any progress, do you know, on this? I know they were talking to China about trying to curtail some of these drug
Companies?
Yeah.
Yeah, I don't know where we are as far as like trying to get them to stop making that actual chemical precursor. I know in China that if anyone sells fentanyl or anything to anybody in China, the consequence is death. So I'm not sure if they're too concerned about what's happening in the United States, and that's just my opinion. Don't quote me on that one. Yes, ma'am.
If I may, kind of add.
Yes,
So
please. Yeah.
I worked in the counter drug field for 3 years. So kind of to answer your question, sir, the biggest issue that they have is that like anytime the U.S. tries to do some kind of legal action or whatever to kind of stop them from making the precursors, they change one little chemical that allows them to bring in more of those type of drugs. So it's the issue is that for fentanyl and for some of these other drugs, the minute that the U.S. does some kind of sanction or whatever action against China to stop these chemical precursors, they're so quick to make another, to change a little bit of the element to add it in.
Yeah, that even thinking about when K2 became big in the country, and basically what they would do is they would change one molecule to bypass the law. So, yeah. Yes.
If you're administering rescue breaths, is there any chance that you yourself overdose or receive any sort of?
Great question. So the answer to that one is no, especially, so thinking about if a person ingests a drug or something like that, right? They've either swallowed it or something like that. The amount of exposure that you would have if you didn't have a face shield would probably be minimal. You have to be exposed to an extended period of time to feel some kind of effect. So like there's a lot of fear that if you see someone unresponsive and they have like residue around them or something like that, right? Then you would technically in that instance you wouldn't have to worry about experiencing any ill effects from helping, if that makes sense. Yes.
How many squirts were in there?
It's 2 doses in each
2
kit.
doses in each?
Yeah, so one of these is one, and then you have 2 of these in your kit.
Okay, so one,
Yeah, 1 squirt. Yeah, so once you press the plunger, that's it, it's gone.
okay.
Yeah. And then you have a second.
One backup.
Yeah, 1 backup. Mm-hmm.
And I will say it's as easy as just going into the fire station and asking.
Yeah.
They'll just give it right to you, nothing asked.
Yep.
My husband went in, it took about 3 minutes,
Yep.
and he was in the car with 2 sets, so. We put it in our care package for college.
Thank you for sharing that, how easy it was, because a lot of people don't believe it.
It's
They like,
so easy, nothing asked.
yes, sir.
Just real quick, you know, like with an EpiPen, if rescue people aren't there within 10 minutes, you give them the second dose, okay? So that's how it works with EpiPen. So is there a time frame with that? So if the emergency response has not showed up, do you administer your second one?
Yeah, so remember I shared that you have that 1 to 3 minute window for it to take effect. So within that 1 to 3 minute window, you're doing the rescue breathing. So after 3 maybe 4 minutes, if they haven't woken up on their own, then I would say hit them with the second dose.
Okay.
Yeah.
And it can't hurt any more doses, right? It doesn't hurt.
So it doesn't, but the recommendation is not to compound it, because what you could do is take a person into what they call, and I hope I don't mess up the word, precipitative withdrawals. meaning like the withdrawal symptoms become harsher because you've compounded how the dosage versus just, doing it back and then giving time and then doing it again.
Okay.
Yeah, well, the last time I did this training, one of the things they also said with regard to that is that if someone is, you just ruined their high. So they're
Yeah,
gonna be really mad.
Yeah.
So to be prepared for that and just be like,
Yeah,
you know.
they could be angry or, oh, you kicked my high off and stuff like that. They might be mad at you, but hey, you just saved their life too. So, yeah. At one point in time in Maryland, they were pushing for 8 milligram doses of naloxone, and the research was showing that it was causing people to experience those severe precipitative withdrawals, and that it didn't really do much of a difference as far as you having two separate doses versus just that one dose of 8 milligrams at one time. So, yes, sir.
Is there a way to determine whether or not a person is maybe just passed out? You know, they have too much, and they'll be fine, they're just sleeping or passed out, or they've had a bunch of drugs, but they're not, there's no risk of death really? Is there a way for the person, you're a roommate, whatever, and you encounter the person who's either drunk or high, and you're wondering, oh my gosh, should I give them this? Is there a way to know, like, oh, they need this? Like,
Right. So it kind of, I would say the recommendation would be to go back to those signs and symptoms. So if they are not breathing and they're not responding and their body is very limp, where like you try to sit them up and they just fall back down, like those are signs that they're probably overdosing, right? So you want to go ahead and administer that naloxone. But if you come in and they're sleeping and maybe you see a substance buy or see that they might have used something, then you can administer, because just like the side effects are minimal and rare, and that could rule out if they're actually experiencing an overdose or not. I always try to be safe versus not, doing anything at all. So we do a lot of outreach in the community in like the different parts of the area, and we come in contact with people all the time that are just, they're not responding. And so, it's been instances where they've been hit with Narcan and Naloxone and things like that. So you just want to make sure that you use every precaution as possible.
Is the pulse,
Oh.
sorry, is the pulse usually elevated or suppressed?
It's slow. It's typically slow. The pulse is typically slow. Yeah.
You mentioned the fingertips too. I mean, that seems like a good idea to be looking because it's not getting oxygen.
Then fingertips start turning blue and pale and stuff like that. Yeah. Great questions. I don't usually get this many good questions. All right. If there are no other questions, I do have naloxone for everyone. I do have our harm reduction flyer here, so I'll leave it with Tara, and maybe she can send it out, or I'll send it electronically and you can share it. And then I'll send Tara a PDF copy of our slides too, so that she can mail it out to email it out to you all as well. All right.
Thank you.
All right. Well, thank you.